Hi there, I'm Dr. Patterson Stark, and what I'd like to do is talk to you today about something that's very dear to me, and it's called metabolic cardiology. And it's the way that we approach people who are candidates for heart disease and heart attack. This is a very serious problem. It kills 1 out of 2 people. And one of my mentors, who is Stephen Sinatra, has written a book called The Cholesterol Myth. Now, this is a part of the story that's really important for you to understand. Your doctor right now is probably not evaluating your cardiac profile correctly because, as I wrote in my book, Stark Health, Live Now, Die Later, over one particular study where a couple hundred people were who had sudden death syndrome, they found that these people who had been evaluated at least 7 days prior to having their major event, not one doctor picked up that they were going to have an event. Now, why was that? Okay. Well, we now know that there are many predisposing factors to heart disease, and they revolve around inflammation, looking at inflammatory markers, looking at lifestyle, and how we read into this with a little bit of knowledge what we can forecast in the future. And the thing that really involves changing these predispositions is simply lifestyle. There is no medication that really works that effectively for heart. Matter of fact, the cholesterol myth shows how statins themselves are generally a scam and have a very narrow window of being effective with cardiac patients. And those are generally middle-aged men who have had 1 heart attack previously are the candidates that do best on statins. Everybody else, you've had to have well over 140 people take a statin for 1 person to get a benefit. So that's not a very good thing when in fact 60 to 80% of people who do lifestyle changes get magnificent cardiovascular effects. And this is not only for heart disease but for stroke also. So the empowering message here is that when we do at Stark Health Center cardiovascular evaluations, as we do with all patients who come in, we're not doing the standard treadmill stuff. We're looking down the timeline 10, 15, 20 years forward and saying, look, you're running into a brick wall here. You need to change the way you eat, the way you exercise, the way you rest, the way you socialize. But these are habits that are modifying the way that your body correctly or incorrectly adapts in its environment. So metabolic cardiology is something you'll hear here, and we're going to give people who come onto our programs, and particularly people under high stress situations, a very thorough going over and make sure that they're aware of how they can modify the risk as we go forward. So thank you very much.